1. Tuberculosis is caused by a gram-negative bacterium known as Mycobacterium tuberculosis. True or false? Answer: false rationale. Mycobacterium tuberculosis is an acid-fast bacillus, not a gram-negative bacterium. Its unique waxy cell wall, rich in mycolic acids, resists standard gram staining, requiring acid-fast staining for identification, per CDC guidelines. 2. Tuberculosis is primarily transmitted through airborne droplets. True or false? Answer: true rationale. TB is spread via airborne droplets when an infected person coughs, sneezes, or speaks, allowing Mycobacterium tuberculosis to be inhaled by others, per WHO transmission protocols. 3. Latent TB infection can progress to active TB disease in all cases. True or false? Answer: false rationale. Only about 5 to 10% of individuals with latent TB infection, LTBI, develop active TB disease, often due to immunosuppression or other risk factors, per CDC epidemiology data. 4. A positive tuberculin skin test, TST, always indicates active TB disease. True or false? Answer: false rationale. A positive TST indicates TB infection but does not distinguish between latent TB and active disease. Further evaluation, like chest X-rays and sputum analysis, is needed, per CDC Diagnostic guidelines. 5. Night sweats are a common symptom of active pulmonary TB. True or false? Answer: true rationale. Night sweats, along with fever, cough, and weight loss, are hallmark symptoms of active pulmonary TB due to the systemic inflammatory response, per American Thoracic Society clinical manifestations. 6. Isoniazid is a first-line drug used to treat active TB. True or false? Answer: true rationale. Isoniazid is a key first-line drug in TB treatment, used in combination with rifampin, pyrazinamide, and ethambutol for active TB, per WHO treatment regimens. 7. Multi-drug-resistant TB, MDR-TB, is resistant to isoniazid and rifampin. True or false? Answer: true rationale. MDR-TB is defined as resistance to at least isoniazid and rifampin, the two most effective first-line drugs, requiring second-line treatment, per CDC definitions. 8. Patients with active pulmonary TB should be placed in droplet isolation. True or false? Answer: false rationale. Active pulmonary TB requires airborne isolation, not droplet isolation, due to the transmission via small airborne particles, per CDC infection control guidelines. 9. The BCG vaccine provides complete protection against TB infection. True or false? Answer: false rationale. The BCG vaccine reduces the risk of severe TB forms, e.g., miliary TB, in children but does not fully prevent TB infection or pulmonary TB in adults, per WHO vaccination data. 10. A chest X-ray showing a cavitary lesion is suggestive of active TB. True or false? Answer: true rationale. Cavitary lesions on chest X-rays are characteristic of advanced active pulmonary TB, indicating tissue destruction by Mycobacterium tuberculosis, per radiologic findings. 11. TB can only affect the lungs. True or false? Answer: false rationale. TB can affect extrapulmonary sites, such as lymph nodes, bones, kidneys, and meninges, especially in immunocompromised patients, per CDC clinical presentations. 12. The QuantiFERON TB Gold test is an interferon gamma release assay used to diagnose TB infection. True or false? Answer: true rationale. The QuantiFERON TB Gold test measures interferon gamma release in response to TB antigens, aiding in diagnosing latent or active TB infection, per CDC Diagnostic protocols. 13. Patients with latent TB infection are contagious. True or false? Answer: false rationale. Latent TB infection is not contagious, as the bacteria are dormant and not actively replicating in the lungs, per WHO transmission principles. 14. Rifampin can cause orange discoloration of body fluids. True or false? Answer: true rationale. Rifampin, a first-line TB drug, commonly causes harmless orange discoloration of urine, sweat, and tears, requiring patient education, per pharmacological side effects. 15. TB treatment typically lasts 3 months for active disease. True or false? Answer: false rationale. Active TB treatment usually requires 6 to 9 months of multi-drug therapy, including an intensive phase, 2 months, and continuation phase, 4 to 7 months, per WHO guidelines. 16. HIV-positive patients are at higher risk for developing active TB. True or false? Answer: true rationale. HIV weakens the immune system, increasing the risk of latent TB progressing to active disease, with a 20 to 30 times higher risk per CDC epidemiology. 17. The nurse should wear an N95 respirator when caring for a patient with active pulmonary TB. True or false? Answer: true rationale. An N95 respirator is required for airborne precautions to protect against inhaling Mycobacterium tuberculosis, per CDC infection control standards. 18. A negative sputum culture definitively rules out active TB. True or false? Answer: false rationale. A negative sputum culture does not rule out active TB, as early or extrapulmonary TB may not yield positive cultures. Clinical correlation is needed, per diagnostic protocols. 19. Ethambutol can cause optic neuritis as a side effect. True or false? Answer: true rationale. Ethambutol, a first-line TB drug, can cause optic neuritis, leading to vision changes, requiring baseline and periodic vision assessments, per pharmacological monitoring. 20. TB screening is recommended for healthcare workers due to occupational exposure risk. True or false? Answer: true rationale. Healthcare workers are at increased risk for TB exposure, necessitating regular screening, e.g., TST or IGRA, to detect infection early, per CDC occupational health guidelines. 21. Patients with active TB can return to work after 1 week of treatment. True or false? Answer: false rationale. Patients with active TB typically require at least 2 to 3 weeks of treatment and negative sputum smears before being considered non-infectious, per CDC return-to-work criteria. 22. The tuberculin skin test measures induration, not erythema, to determine a positive result. True or false? Answer: true rationale. The TST result is based on the size of induration, raised area, not erythema, redness, measured in millimeters, per CDC diagnostic criteria. 23. Isoniazid monotherapy is used to treat active pulmonary TB. True or false? Answer: false rationale. Active TB requires a multi-drug regimen, e.g., isoniazid, rifampin, pyrazinamide, ethambutol, to prevent resistance. Isoniazid monotherapy is used for latent TB, per WHO guidelines. 24. TB can be transmitted through contaminated food or water. True or false? Answer: false rationale. TB is primarily transmitted through airborne droplets, not food or water, except in rare cases of bovine TB from unpasteurized milk, per CDC transmission data. 25. Hemoptysis is a symptom of advanced pulmonary TB. True or false? Answer: true rationale. Hemoptysis, coughing up blood, occurs in advanced pulmonary TB due to lung tissue damage and cavitation, per American Thoracic Society clinical manifestations. 26. Directly observed therapy, DOT, is recommended for TB treatment to ensure adherence. True or false? Answer: true rationale. DOT, where healthcare providers observe medication intake, improves adherence and reduces resistance risk in TB treatment, per WHO recommendations. 27. A positive interferon gamma release assay, IGRA, confirms active TB disease. True or false? Answer: false rationale. A positive IGRA indicates TB infection but cannot differentiate between latent and active TB. Further tests like chest X-rays are needed, per CDC Diagnostics. 28. Pyrazinamide is used only during the continuation phase of TB treatment. True or false? Answer: false rationale. Pyrazinamide is used during the 2-month intensive phase of active TB treatment, not the continuation phase, due to its bactericidal activity, per WHO regimens. 29. TB infection can remain latent for years without symptoms. True or false? Answer: true rationale. Latent TB infection can persist for years or decades without symptoms, with bacteria dormant in the body, per CDC Pathophysiology. 30. Patients with NCLEX-RN require shorter treatment durations than those with drug-susceptible TB. True or false? Answer: false rationale. NCLEX-TB treatment lasts 18 to 24 months with second-line drugs, longer than the 6 to 9 months for drug-susceptible TB, due to resistance, per WHO guidelines. 31. The nurse should teach TB patients to cover their mouth when coughing. True or false? Answer: true rationale. Covering the mouth when coughing reduces airborne transmission of Mycobacterium tuberculosis, a key patient education point, per CDC infection control. 32. A chest X-ray is the only diagnostic tool needed to confirm active TB. True or false? Answer: false rationale. A chest X-ray supports TB diagnosis, but requires confirmation with sputum culture or molecular tests, e.g., GeneXpert, for definitive diagnosis, per CDC protocols. 33. Rifampin requires monitoring for hepatotoxicity. True or false? Answer: true rationale. Rifampin can cause hepatotoxicity, necessitating regular liver function tests during TB treatment, per pharmacological monitoring guidelines. 34. TB is more common in urban areas than rural areas. True or false? Answer: true rationale. TB prevalence is higher in urban areas due to crowding, poor ventilation, and higher population density, per WHO epidemiology data. 35. The BCG vaccine is routinely administered in the United States. True or false? Answer: false rationale. The BCG vaccine is not routinely used in the U.S. due to low TB prevalence and variable efficacy. It is more common in high-burden countries, per CDC vaccination policy. 36. Patients with active TB should avoid contact with infants. True or false? Answer: true rationale. Infants are at high risk for severe TB forms, e.g., miliary TB, necessitating avoidance of contact with active TB patients until non-infectious, per CDC guidelines. 37. Isoniazid can cause peripheral neuropathy as a side effect. True or false? Answer: true rationale. Isoniazid depletes vitamin B6, potentially causing peripheral neuropathy. Pyridoxine supplementation is recommended, per pharmacological side effects. 38. All TB patients require hospitalization during treatment. True or false? Answer: false rationale. Most TB patients can be treated outpatient with DOT unless they have severe disease, complications, or adherence issues, per CDC treatment protocols. 39. Contact tracing is a public health strategy for TB control. True or false? Answer: true rationale. Contact tracing identifies and screens individuals exposed to TB, enabling early detection and treatment to prevent spread, per WHO public health strategies. 40. A 5 mm in duration on a TST is considered positive in all populations. True or false? Answer: false rationale. TST induration thresholds vary. 5 mm is positive in high-risk groups, e.g., HIV positive, 10 mm in moderate risk, and 15 mm in low risk, per CDC criteria.